Okay, hello. Alright, from the beginning. Hello, Mr. Mastin. It's me, Michael O'Leary, and this is my project on the coronavirus. Alright, introduction. We all know what the coronavirus is, for it kept us stuck inside with no in-person contact with anyone for months last year. Quarantine. But many people only knew what the virus was through the news, which only highlighted how many people tested positive, how many people died, and the symptoms of the virus. Meaning not many people know how the virus actually works. So here's how it works. How does the virus work? The coronavirus is like any other virus. It infects your healthy cells and multiplies within you. But the coronavirus latches on with spiky proteins to your body's receptors and it infects it there, usually within your lungs, as shown by the respiratory symptoms like coughing and shortness of breath. Once it gets into your receptors, it hijacks the healthy cell and takes command, and soon after it will start to kill the healthy cells around it. So, in your lungs, will start to do that. How does the virus get in you? Well, the virus travels through the air and can be breathed out by someone who has it. So, it travels through the air and can be breathed in for you to get it. So, as shown by why you should wear a mask, because then you have less of a chance of breathing it in. The virus, once in, will travel through your respiratory tract to go through your body. Your lower airways have more ACE2 receptors than the rest of your respiratory tract, so COVID will most likely go there to latch on and take over, like mentioned before in the slides before. Now, how can the virus harm you or symptoms of the virus? 8 out of 10 cases, according to statistics, are only mild cases of the virus to where nothing severe may happen at all during their time dealing with the virus, those 10 to 14 days of having it. But 2 out of 10 cases can have serious life-threatening problems. So some of the mild cases are fever, cough, shortness of breath or trouble breathing in general, fatigue, chills with shaking, body aches, sore throat, congestion, loss of taste, loss of smell, nausea or vomiting, diarrhea, pink eye, rashes. Some serious problems that can come are liver problems or liver damage, heart problems, kidney damage, dangerous blood clots in their legs, lungs, and arteries, which could cause a stroke. Another serious symptom of COVID is ARDS. ARDS can cause rapid breathing, a fast heart rate, dizziness, and sweating. It damages the tissues in the blood vessels in your alveoli, causing debris to collect inside of them, which makes it harder to breathe. As fluid collects in your lungs, they carry less oxygen to your blood. Your blood may not supply your organs with enough oxygen to survive, and to remedy this, you can use a ventilator to supply more oxygen that your body's not making. And ARDS can cause your kidneys, lungs, and liver to shut down and stop working. Treatment for coronavirus. Treatment for coronavirus may include oxygen through a ventilator for severely ill patients and those who are at risk of severe disease and need more advanced respiratory support. For those that require more oxygen to be able to get enough oxygen to all of your body to survive. But another thing you can take is dexamethasone, a corticosteroid, that can help reduce the length of time on a ventilator and save lives of patients with severe and critical illness. So they're just tablets you take. Prevention of coronavirus. To prevent COVID-19, there are many things you can do to help prevent getting the illness. Weakened immune systems are more susceptible to the coronavirus. So being a healthy person in general, before contact with coronavirus, would help prevent it entirely or make the symptoms less severe to get a mild case instead of a life-threatening case. Another thing you can do is wear a mask over your nose and mouth to block the particles from getting breathed in by you. Yes, there are some studies that show that not all masks are super effective, but they are effective in some way of keeping your mouth out of the way of the particles of freely entering. Now they have some sort of barrier that they have to try and get through. And the final thing you can do, the best thing you could do, is get the COVID vaccine, which creates antibodies in your body to fight off the virus. So if you ever come in contact with it, having this before could fight it off, or it could fight off the virus before it gets severe within your body. Now, generation/age statistics of COVID-19. Total cases worldwide, according to Google, is 148 million cases, where 85.2 million recovered from the virus, but 3.12 million people died from the virus. According to these statistics, as shown on the screen, Older people, usually in the boomer generation, are more susceptible to dying from the virus compared to younger people, usually in the millennial and zoomer generations, as shown by how 50-year-olds and up have higher percentages of dying compared to 49 and below, which have very low percentages of deaths. But millennials and zoomers, those age generations, get it more often compared to boomers, as shown by how ages under 18 up to 64 have higher percentages than 65 up. But the millennial and boomer generations have very low death rates, as shown by here, under 18 to 49, they all have very low percentage rates that don't even go above 10%. Now, the reason why the younger people have a lot more cases is that they're aware that they could survive the virus, because we know a lot about the coronavirus, and we already know that if you're an older person, you have a greater chance of dying from the virus. But younger people, they have a very high chance of surviving the virus, so they don't have to stay indoors and quarantine forever to risk their life. There's no risk in going outside and maybe getting it, because you're only just gonna have a flu, or not the flu, a cold for a little while. It's not life-threatening. But for an older person, yes, their cases are lower because they're trying to stay indoors and stay protected from it. Here's my Works Cited page. Yes, okay, thank you. Bye.